Yeah, and Candace, as state officials are preparing for the possibility of a coronavirus case in Virginia, also learning how at least one local hospital system is preparing as well. A spokesperson for HCA Virginia saying starting this week, they're asking any patients and visitors to use specific entrances at their hospitals, specifically the main and emergency room entrances, so that they can be properly screened. And they say that if anyone is showing symptoms, they'll respond in a way that gets that person the treatment they need, while at the same time reducing exposure to anyone else at the hospital. Now, as we talk about how local hospital systems are responding, the state says they are testing more people for a possibility of coronavirus. 17 in total. 14 cases have come back negative, but they are still awaiting the results of 3 possible cases, 2 of them here in Central Virginia. And right now, those tests are being done at this lab in Richmond. A worker prepares a sample to be tested for coronavirus at the state lab now handling all possible cases in Virginia. A change instituted this week, which state officials say gives them results in hours instead of days if they waited on the federal lab in Atlanta.
It means that we're able to institute any kind of countermeasures that we need to institute more quickly.
Officials add they have the capacity for over 100 tests at the moment and have asked for more test kits.
This team's job.
The information was part of a news conference Wednesday where state officials discussed preparations for the coronavirus should a case be confirmed.
There's a lot of anxiety, and we want to keep people calm. We want to keep things going as the way they are in Virginia and just make sure that everybody knows we're prepared.
Governor Ralph Northam says a response team has been monitoring the virus since the beginning of January and meets daily to discuss updates.
We've got that firm foundation as a Commonwealth in terms of getting the tools to the governor that he has, that he can activate depending on the situation as it evolves.
Leaders add they've also secured over $3 million to cover any response over the next 90 days for things like safety equipment and staffing costs.
Over the next 12 months, over and above that, there could be a potential for another $6.5 million that may be necessary in direct cost.
And the response team's leader adds the risk of Virginians right now is low, but encourages people to continue to monitor their website for the latest on the virus.
Don't panic, stay informed, and we'll keep information updated as it changes.
And again, still awaiting the results of 3 tests in the state for possible cases of coronavirus, 2 of them here in Central Virginia. And state officials say that while they're doing their preparations, there are simple things you can do, like washing your hands using hand sanitizer. If you don't have that, coughing into a tissue and tossing that tissue out, avoiding people who are sick, and as well avoid touching your face if your hands are unwashed. Working for you in Richmond, Cameron Thompson, CBS 6 News.